I will first start by scanning the room, also showing my note card that will be sitting here on the table. Nothing's on the back, wrote on the front. Hello, my name is Brill. I will be doing a head-to-toe assessment on you today. I will first start by providing privacy by closing the curtain and performing hand hygiene. I will ask you, what is your name?
Nathan Hill,
Your date of birth?
March 20th, 2006,
And your location?
LaGrange, Tennessee.
Okay, so I will say that my patient is alert and oriented times 3. He's able to hear and speak back as he was able to answer my questions. He has good mobility as he was able to walk into the room today. His skin is appropriate for ethnicity, and his mood is calm and cooperative, and his posture sitting on the couch, I would say that he's kind of a little slouched, but it's okay. And I will start my head-to-toe assessment. And for this assessment, we will keep him fully clothed and just do the items. So I'll first start by looking at his head. Just make sure that I see no lesions, no mass, no abnormalities. His head is symmetric to his body. I will feel, just to make sure I don't feel any mass in his head. Make sure he has no tenderness. I will then take my pen light and check his ears. And I will just check to make sure there is no redness and no drainage coming from each ear. His ears are symmetric to his body. And I will then ask you to clench your teeth. All right, clench your eyes. Now try to wrinkle your forehead. All right, and puff out your cheeks. All right, stick out your tongue. Move side to side. Okay, I will say that his cranial nerves 7 and 12 are intact. I will then look at his eyes to check for pupil constriction, and they do. All right, so would you look for in the distance for me? All right, and back in my pen light. All right, so I would say that his eyes is perla, and they're sensitive to light. I will then look at his conjunctiva, and I will say that they're pink and moist. I will now palpate his maxillary and frontal sinuses. Any tenderness? All right. So I will say that there is no tenderness and no lesions, no inflammation. I will now check the patency of your nose. Will you put one finger over your nose and try to breathe out the other nostril? All right, in the other nostril. Okay, I will say that he has nasal patency. Okay, would you open your mouth for me and say ah? Raise your head up a little bit. Thank you. Ah. All right, and stick your tongue out. All right. So I would say that his tonsils is a grade 1. His let me see, under your tongue. All right. His palate is intact. His gums are moist and pink. And now I will look at your neck to check your lymph nodes and your cervical lymph nodes. Any tenderness? All right. So I'm gonna look at your neck now and check to make sure his trachea is midline and no lesions and no tenderness. All right, so if you will raise your arms for me, I'm going to check your axillary lymph nodes as well. Any tenderness on either side? All right. All right, can we check the reflexes of your neck? Will you bend your head down for me? Both. Oh, and up. Thank you. And side to side. And down again. All right, so I would say that he has reflexes in his neck. I will now listen to his chest. I'm going to start by looking on the side of him. I would say that his chest is an AMP 1 to 2 ratio. And I will start by listening to you. And every time I move my stethoscope, will you just take a deep breath, okay? I'm going to listen to you 6 times on the front, 6 times on the back, and 3 on the side. Take a deep breath for me. All right, I'm now going to listen to you on your back. right, now I'm gonna listen to you 3 times on each side, okay? All right, your opposite side. Okay, I will say that his norms is clear, and which is normal and what we would like to hear. We don't want to hear any crackles, and is absent of crackles. All right, so now I'm going to listen to his heart, and I'm going to listen to it in 5 places on your chest, okay? So you can just breathe normally. I'm going to listen to your aortic, your palmic, your herbs, tricuspid, and your mitral. All right. So now I'm going to listen to your apical pulse for 30 seconds, okay? And I'm going to start now. All right. So your apical pulse was 40. So I'm going to times that by 2. And that will mean your apical pulse will be at 80, if you will. Would you lay on the couch for me so I can check your abdomen? And just lay on your back for me. All right, so first I'm just going to look at it and make sure that I don't see any lesions, nothing protruding out your abdomen. I'm going to then listen to you so I can see if you have any bowel sounds, okay? All right, so I listened to him in all 4 quadrants. Now I'm going to do a light palpation in each 4 quadrant, okay? Any tenderness? All right, I'm going to do a deep palpation just to make sure I don't feel any enlarged livers or any enlarged organs. Do you have any tenderness as I'm touching? All right. I would say that his bowel sounds are hyperactive as he just eating. I can hear his bowels moving. I will now have you sit up on the couch for me, and I'm going to check your reflexes. If you will, tap your hands multiple times on your lap for me and try to do it faster. All right. Okay, now we're going to do a finger to nose test. So you're going to do a finger to nose. Both hands. All right. All right. So just using that one hand, would you do from finger to my finger? I mean your nose to my finger. All right, now let's try it with your other hand. All right, okay. So now we're gonna do a light sensation, your thumb to your fingers to see if you can touch your thumb to each finger. All right, try to do it faster. All right. Okay, so could you tap your feet for me? All right. Now, would you take one of your foot and put your heel down your shin? Start at the top, yeah, and slide it down. All right, try your other foot. Okay. All right. So, if you will, just stand up for me. Okay. And turn to the side. I just want you to bend over and touch your toes. I'm going to check your spine, okay? So I would just palpate his spine just to make sure I don't feel any scoliosis or any curvatures, and his spine is fine. Could you stand up for me? All right. Okay, we're going to do a balance test called the Ramberg's test. If you will, just stand right there with your feet close together. All right, and try to close your eyes. And I'm going to stand on the side of him to see if he starts swaying. Try to lift one foot at a time. All right, try the other foot. All right, so you did great and you passed the test. Okay, so if you will, stand right there and walk to me normally. Okay, you can turn around. And could you walk on your tippy toes only? All right, would you turn around? And would you try to walk on your heels only? All right. So that concludes my head to toe assessment on my patient, and thank you.